Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Stephanos Gozali. You are a pharmacy resident at Peninsula Regional Medical Center, and you are a local product. You were born and raised here, and you're doing some pharmacy training at the local hospital. And you are here to talk to us today about thyroid medications.
Yes, and thank you once again for having me today.
Now, I know there's two kinds of basic disorders with the thyroid gland that's located in our neck. You either can have too much hormone or not enough. And I know you want to start out with the basic pathophysiology of what the thyroid gland does. So talk to us about that.
Yeah, certainly. So with thyroid, the whole purpose of the thyroid is to basically produce these glands that will help, and hormones that will help stimulate certain parts of your body in terms of like hair growth, hormonal development, and those kind of things. I'm not going to go super deep into detail, but basically the whole purpose is to, create these hormones for your body that are essential to develop. Now, in a thyroid disorder, you can have either too much of that form of a thyroid hormone or too little. And depending on which one it is, it can affect, you'll see different symptoms that go with it.
I know a great deal of what the thyroid does as well is metabolism. So if you don't have enough hormone, you can be in a very slow metabolic state. And if you have too much, you're revved up in a hypermetabolic state. So this is a very important hormone. You cannot live without having proper levels. So that's why it's so important, I think, that we start off with hypothyroidism when you don't have enough of hormones. So I'll let you take it from there with talking to us about what hypothyroidism is, and then, of course, the medications.
So with hypothyroidism is basically you don't have enough of free thyroid levels in your body. Your endocrine system is basically making these thyroid stimulating secretion hormone, which is a signal for your body to make more of this hormone. However, there is some sort of disruption that happens in that process. So even though the signal is telling your body to make more, none's being created, not as much is being created. So that leads into a deficiency of your thyroid. Some symptoms that you'll see with this is, like you mentioned before, the slow metabolism. So a lot of times patients will have weight gain. They'll feel very cold, very fatigued. They're very cold is really what the most common symptom is for this sort of hypothyroidism issue. It's very common in women, actually 5 times more common in women. And every year there's about 200,000 new cases in the U.S.
It is fairly common to see people on this particular medication that you're going to discuss. So talk to us about that. I know it's levothyroxine. It has other names, but the brand name that most people may be familiar with is Synthroid. So talk to us about Synthroid.
Yeah, certainly. So in this sort of disease pathophysiology, you don't have enough thyroid hormone. So the treatment plan would be to have supplementation, medication that will give you supplement thyroid. So levothyroxine or Synthroid is the most common medication that you might see in the pharmacy or in the world here. And it's basically synthetic T4. So synthetic T4 it's basically what you think it is. It's synthetic thyroid that gets metabolized into the active formulation. Now, there are also other medications available, such as thyroid USP, thyroid globulin, leothyroxine, and leotrix. These are less common medications that you might see for thyroid, for hypothyroidism. However, they still exist, and there's a lot of differences between all these medications. Generally speaking, when your provider puts you on one medication, you find one that works for you, you want to stay on that medication. Each thyroid medication is composed of different material. So, for example, the thyroid USP, its contents come from beef or pork, whereas the levothyroxine is synthetic. So, if you were to switch from one to the other, it might be a little bit difficult to do that.
just to get back to the side effects, obviously if you're replacing hormone that you're deficient in, and of course bradycardia or a slower heart rate can be a symptom of hypothyroidism, then you're saying we need to monitor what happens if you're getting too much replacement hormone, and someone can actually have their heart rate go above the normal range of 60 to 100. So talk to us a little bit more about that.
Yeah, certainly. So with hypothyroidism, a lot of times these patients will have a very slow resting heartbeat. So bradycardia is the medical term, and patients will feel like it will contribute to that fatigue that patients are feeling. Now, if you're supplementing the patient with thyroid medication, the opposite can occur if it's too much. So your heart rate can actually go above the 110 beats per minute, and the patient can develop tachycardia. So a lot of times the symptoms of tachycardia that patients should look out for, they can feel like their heart is beating like really quickly. Sometimes you can notice that. Additionally, if you're just shortness of breath just from normal walking or anything like that, that could be a sign of your tachycardia as well. But mainly it's just like if the patient feels like his or her heart is beating like progressively faster. That's predominantly the main sign of tachycardia.
So I guess they can keep an eye on their own pulse rate as well as see their provider regularly.
Yes, and that's actually what's recommended in terms of treatment for any of the thyroid disorders, hypo or hyperthyroidism. You want to regularly check in with your provider. Sometimes the provider will want to see the patient a little bit earlier in the beginning stages of treatment, but generally speaking, every 6 to 8 weeks, you want to follow up with your provider, look at labs, see how you're doing symptomatically.
But overall, levothyroxine or Synthroid is a very safe medication, and it's basically just replacing, hormone that you're not having enough of.
Yes, it's very tolerable. It doesn't have a lot of adverse effects.
And generally, you take it in the morning, I think, before breakfast.
So it's recommended that you take it 30 minutes before breakfast. You want to take it on an empty stomach. So if it's easier for you to take it at night after dinner, then that's also appropriate, but you just want to make sure you take it on an empty stomach, is because food can actually disrupt the absorption of the Synthroid.
But it does have to be taken every day,
Yes,
just for the rest of your life. But it's a relatively, easy, quote unquote, treatment, effective treatment for this disorder. So let's move on to hyperthyroidism. This one's a little more tricky. So talk to us about this and what exactly goes on with hyperthyroidism, which is also referred to as Graves' disease.
Yes. So for hyperthyroidism, the opposite is happening. You have a lot of your thyroid hormone, and within the whole complex of the thyroid mechanism, when you produce a lot of T3 or T4 that can metabolize to T3, there's a signal that goes back to your pituitary gland that tells your endocrine system to, hey, we have enough T3, stop making more thyroid. However, now that sort of pathway, there's something blocking that pathway, or something is disrupting that pathway. So your body cannot tell your endocrine system cannot tell your body to stop making more thyroid, even though you have a sufficient amount of thyroid. So when you have too much thyroid in your body, basically you're at risk for hyperthyroidism. And those symptoms are the opposite as hypothyroidism. So you're feeling very anxious, you're sweating very easily, you have heat intolerance, you feel that tachycardia. And those are some of the symptoms that I noticed that patients will notice with this disease.
So this disease also can be treated with medication. I know you want to talk about those.
Yeah, and so in this sort of situation, the treatment, there's different treatment options, but I want to focus on the medications. So the medications, the predominant medication is methimazole or tapazole. That's the most common medication you'll see. It's a thyroid hormone synthesis inhibitor. So how it's going to work is it's going to help inhibit production of new hormones. So it's not going to do anything with the hormones that's already excessive in your body at the moment, but it's going to help prevent production of new hormone. And so because of that, patients won't be able to see the effects of the methimazole for about 4 to 6 weeks even.
But it is very effective. I know it's a newer drug compared to PTU or propylthiouracil, which has been around a very long time. But that one you had to take several times a day. How often do you have to take the tapazole?
So, but the Hypothyroidism, when you're first starting the medication, typically is twice a day. And after you start to see symptomatic improvement and the patient's labs are looking better, you can decrease the dose to once a day. And then for the propylthiouracil, it is an older medication, and it's generally more commonly seen now for pregnancy.
Now, what are the general dosing recommendations, as you mentioned, or any side effects?
So for side effects, both the medications are fairly well tolerable. You want to look for methimazole. Now, the same concept almost applies in terms of levothyroxine, except the opposite now. So now, if we're cutting thyroid too much, the patient might actually experience those symptoms of hypothyroidism, so that coldness and that fatigue. So those are things to look out for and monitor, as well as now your heart rate going from beating greater than 110 beats per minute is now decreasing to more bradycardic. So the heart rate's decreasing in terms of beats per minute, and patients can look out for those things as well. It's the propylthiouracil, which is seen in pregnancy, that is has a little bit more adverse effects because especially since it's dosed twice a day. But sometimes you can see like abdominal pain or anorexia, or sometimes patients can even experience an itchy rash.
You want to talk a little bit about Thyroid Storm, what exactly that is?
Yeah, so and I think it's important when you're talking about hyperthyroidism to mention about thyroid storm. This is a life-threatening condition, and it can occur when you have an excess of thyroid hormone. So basically what's happening is you have so much thyroid hormone that it's just going to affect your body in so many different ways. The patient, if someone's going through thyroid storm, patients can have tachycardia as well as hyperprexia, so they can have an elevated increase in temperature, elevated heart rate. They can also be super anxious, super agitated, and patients can even go into a coma if this is left untreated. And I think it's important to mention this because why this occurs, there's still debate in terms of why thyroid syndrome occurs, but for the most part, a lot of medical professionals are kind of siding with the belief that untreated hyperthyroidism can lead to this, which makes sense. If you're not going to treat the thyroid levels and you have so much in your system, you are at risk for a thyroid storm. And then also abrupt cessation of anti-thyroid drugs, which I think is really important as well, to make sure to stress that when you start this treatment, you don't want to just completely stop the medication because it could lead to an overproduction of thyroid.
And isn't this condition of Graves' disease or hyperthyroidism more common in women as well?
Yes, so this is also more common in women than in men. I think it's about 5 times more common in women.
Yeah, I mean, it's something we see, and it's something that women should get screened for, particularly as they're in their 40s or so. We can start seeing this hypothyroidism as well. I know hyperthyroidism tends to occur in women in the 20 to 40-year range. Whereas hypo, we can see it a little later on. And it's actually, both of these diseases can be rather well managed with medication.
Yes.
So any summarizing points you want to make about these types of medications with regards to thyroid function?
Whichever one it is, hypo or hyperthyroidism, when you find the medication that best suits you, especially for hypothyroidism, make sure you continue taking that medication on a daily basis. Methimazole is also daily, and I forgot to mention that. It depends, the maintenance is daily. But you want to make sure you take the medication. Don't abruptly stop the medication, because if you abruptly stop, then basically your body can react to what's going on. We had too much or too little, and now you can have an overproduction or underproduction, depending on which medication you're taking. And then there's also some good resources out there for patients if they want to look into more. So the American Thyroid Association is probably the resource I would recommend the most. It has very good patient-friendly brochures. They have a lot of good guidelines and research data if patients want to be a little bit more savvy and dive into the literature a little bit more. Additionally, because this is more common in women, womenshealth.gov also has resources available in terms of thyroid disorders. Now, I will say for the womenshealth.gov, they're going to focus a little bit more about pregnancy, which we didn't really talk about today, but nonetheless, those are two excellent resources to use.
Okay, and thank you. And we'll post those at the end of the program where people can see those websites and check them out. And, you know, with this, it's all about balance, isn't it? Just keeping that thyroid hormone level within a specified range. And thank you so much for providing us with all this very useful information.
Yeah, and thank you for having me once again.
And thank you for joining us for this edition of Focus on Health here on PAC 14.